In general, in the United States population, hypertension increases with age, and so medical providers as well as people living with hypertension or with other diseases are more aware of hypertension as they get older. In the general U.S. population, hypertension awareness, being someone who has hypertension and then knows they have hypertension, is more common in older individuals. And we wanted to study that in people with multiple sclerosis. The more we know about comorbidities in people who are living with MS, we know that having additional diseases, especially diseases that are ischemic risk factors, lead to worse disability and worse outcomes in those individuals. And we can't really target hypertension as one of those risk factors if we don't know that people have hypertension. So what we sought out to do is actually just to see how common it is to have hypertension, and of the people who have documented hypertension by their vital signs, how many of them actually knew that they had hypertension and carried that formal diagnosis. And what we found is that many people are unaware that they have hypertension. When you look at their vital signs in a chart, they should meet American Heart Association diagnostic criteria, but they don't realize that and they're not being treated for that. And age specifically is a contributing factor or associated with hypertension unawareness, not being aware of it. So the older someone gets, the more likely they are to be aware of their hypertension, and the younger individuals, people who are maybe just seeing their MS specialist and not necessarily getting all of their proposed screening tests from a primary care doctor, seem to be less aware of their hypertension. So that age group, the younger people specifically, if an MS specialist is taking care of their MS, but they noticed an elevated blood pressure reading in their clinic vitals, that should be something that maybe as MS specialists we become more aware of, because that person might not be getting that managed, might not be aware that they have that, and we might be the first persons catching it. So in our data, what we found was that women were specifically at a 7 times increased odds of having hypertension unawareness. So hypertension is not being recognized as frequently in women as it is in men, which does also match the broader U.S. population when you look at just hypertension data, and so that is well supported that we really should be potentially focusing more on screening women to make sure that we're catching those diagnoses of hypertension in those individuals. In terms of talking about different severity, while the MS severity, we don't have certainty of those associations with hypertension unawareness yet. What we do know is another factor in being unaware of hypertension is the level of hypertension. So the American Heart Association categorizes hypertension as being stage 1 or stage 2 hypertension, which are both above elevated blood pressure or normal blood pressure. Stage 1 hypertension is individuals whose blood pressure is above or at or above 130 systolic or at or above 80 diastolic, but under 140 systolic or 90 diastolic. And stage 2 hypertension, which is also considered uncontrolled hypertension, is those individuals who are living above 140 over 90. And what we see is that people who are in that uncontrolled hypertension category are aware that they have hypertension. So when it's severe, it's being caught, they're aware of it, even if it's not yet well controlled, they know that it's an issue. Whereas the individuals who are not yet at that stage, but do have diagnostic criteria of hypertension, which is any hypertensive blood pressure reading at multiple visits over time, but even if it's stage 1 hypertension, those individuals are maybe less aware of it. And so milder hypertension seems less aware. The importance of that, we don't yet know, right? It might be more important to capture the people who are really severe hypertension, and it seems like we are doing a better job in that group. But it might be very important to capture hypertension early in this more controlled group before they become uncontrolled hypertension. And so another area where MS specialists might play a role is when they're capturing these early hypertension. They have a couple of borderline readings, a couple of stage 1 hypertension readings. They're not flagrantly in hypertensive emergency or hypertensive crisis, but that they at each visit are like just a little hypertensive, even if we're not taking control of that treatment as MS specialists, making sure those individuals are seeing primary care doctors and asking their primary care doctors, hey, do I have hypertension? Do I need to be treated for hypertension? Making sure that we make the patients empowered in knowing their own disease and potential diagnoses and who they should be seeing for that is a gap in care in MS right now that we can really help close the circle in comprehensive care in MS by including the patients in these comorbidity diagnoses and getting them to primary care doctors or the right doctors to manage those comorbidities with us.